I'll give you guys even an extra Easter egg. What is a really crucial number to actually look for low iron? What is a hidden cause of hair loss that you don't even know about? Iron, low iron. Yeah. And why do so many of you not know? Because none of your doctors know about this. Because I can tell you right now, how you test for low iron already is kind of sucky. But that's a whole different ball of wax, which is the way that we test for low iron in people is asinine. Because people are waiting till doctors are waiting till you're anemic and then say you're low iron. But that being said, if you're already anemic, you already know you're low iron. This applies to you. For those of you that are suspecting it, I'm going to tell you right now is that in our program, Transform Autoimmune, there's a whole blood panel of the accurate ways to test for thyroid, iron, you name it, everything. And I'll give you guys even an extra Easter egg. What is a really crucial number to actually look for low iron? Ferritin. Ferritin. Okay. That's all I'm going to say. Okay. But in our program, we test for that and we actually teach you what those values mean, what the functional values are. It's a whole ball of wax. But anyway, if you already know you're low iron and you already suspect it, I'm going to tell you that iron actually has many mechanisms that affect many things in autoimmunity. Did you know that low iron makes you cold? Did you know low iron makes you fatigued? Did you know low iron causes depression? And did you know low iron causes hair loss? And it kind of makes sense because when you have low iron, your red blood cells are really, really tiny. When they're really, really tiny, they don't carry that much oxygen and they don't flow to the areas they need to really well and supply a whole bunch of good shit to all your cells. And that's why for me, once you know you're low iron, or even if you suspect it, taking a quality iron is going to be crucial. And that's where the other place people go wrong. Insider tip: 99% of iron that you buy on the market is shit. And the reason is shit is because it's synthetic iron called ferrous sulfate. Ferrous sulfate is synthetic, really cheap to produce, and 90% or more of it never absorbs, which is why the iron you buy will cause nausea and constipation because it's sitting in your bowels and not being absorbed, causing a ton of bad juju. Okay. Which is why for me, come on, let's get you educated and buy some real good iron. Ironworx is my iron that is a natural iron at the right dose to be 90% absorbed versus 90% not absorbed in synthetic iron. Well, if you're going to pay for iron anyway, why not just buy an iron that's going to be 90% absorbed? And when it's 90% absorbed, the likelihood it causes nausea or constipation becomes nil to none. So, how important is it to get the right iron? Crucial. So, which is why Ironworx is the iron that I vetted, curated over the last 24 years of my career. Swear by it. It's really a wonderful natural iron. And I would definitely start at just one a day. And depending on and work with your doctor on the low iron thing. I would start one a day. Make sure that you tolerate it well. And then depending on where your labs and what your doctor recommends, you may need more of it, but one a day would be really great. But a quality iron, come on. And a quality iron, guess what? Needs some cofactors to make sure it's absorbed and utilized. So you know what? Even when you get a prescription iron, which is ferrous sulfate, does it come with the cofactors needed for absorption? No, because that costs a couple extra cents. And so it is in Ironworx to make sure that you get optimal absorption of iron and proper utilization of iron. Well, actually, we just did an interview with Merritt about 2 weeks ago, and we're going to be premiering that in the next week or two. You have to see the before and after photos. Dramatic. And Merritt, I would love for you in the alumni section just to comment on what your experience on your hair loss is. I know going through the program, you were like, hair, 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 and you were so impatient about it, but tell people where you are at a year later, all right? I love this. Real people, real results. That's what I'm all about, and I only recommend shit that works. And that's about iron. I can tell you right now, we have tons of interviews of alumni in our Facebook group that have autoimmune disease across the board, and yet they have hair loss as a symptom and they were able to reverse it. Okay. So it doesn't matter what the diagnosis is. Hell no. How frequently is hair loss a problem? Every autoimmune disease has hair loss as one of the most common symptoms. So how important is it to address the root causes of what's causing autoimmune disease so you deal with not only all the autoimmune targets, but hair loss at the same time? 100% crucial, which is why it's really important, guys, to really think on a bigger scale, which is that there is a root cause approach to dealing with autoimmunity. And I call it, if you're chasing all these symptoms, it's like whack-a-mole. Whereas if you actually hit the root, like I think about it as a tree thing. So, like if you're sitting here and you're looking at an apple tree, and all these apples are diseased with different, like, they look different. They're kind of like, and you can sit here and play whack-a-mole and say, I'm going to see this specialist and this specialist for each of these apples. Or what makes more sense is hit the root. What disease is coming from the root? What are the triggers in the root so that you can actually deal with the root cause in that tree and deal with all the apples all at once, regardless is hair loss, fatigue, pain, insomnia, whatever the heck it is. So if you're interested in learning what a root cause approach to autoimmunity is, make sure you write 5 pillars in the comment section below. I'm going to have my team put a link to watch the training I did on what the 5 pillars of a root cause approach to autoimmunity is.